at this point in time in our lives, right? A lot of them are as low as 9 years old trying marijuana now, okay? Start using it at that age, now over time, you're just gonna start wrecking your brain, right? There's debate out there about whether there are significant long-term effects, things like that, but there's a lot of data out there about how detrimental this can be. There's arguments of, is it a gateway drug, is it not a gateway drug? It absolutely is, especially if you have that addictive personality. So, physical effects, breathing problems, marijuana smoke irritates the lungs, and frequent marijuana smokers can have the same breathing problems that tobacco smokers use. So it makes sense, you're breathing in, unless you're using a vapor or you're cooking it in your food and things like that, you're breathing in a thick amount of smoke, it's gonna start wrecking your lungs, just like when you smoke cigarettes. All right, you can go ahead and develop lung cancer from that as well. Increased heart rate, right? When you smoke weed, your heart rate's gonna be up for a minimum of 3 hours. Problem with child development during and after pregnancy. If a mother is smoking marijuana while she's pregnant, there's definitely a whole list of problems that the child can actually develop because of it. Mental effects. Long-term marijuana use has been linked to mental illness in some users. Temporary hallucinations, temporary paranoia, worsening symptoms in patients with schizophrenia. Marijuana use has also been linked to other medical health problems such as depression, anxiety, and suicidal thoughts. Amphetamines. So, just like the movie said, amphetamines refer to a group of drugs that are central nervous system stimulants. They're both illegal and legal drugs in this category. Okay? Like I said, they can be beneficial. Somebody that actually has ADHD, narcolepsy, other disorders. However, when you start abusing them, now we start looking at the addiction and the actual physical problems that come from it. Because if you are taking it and it's prescribed to you, you're under the care of a doctor who's going to be monitoring your intake and everything like that. Okay? Start taking it on your own. You got nobody that's monitoring what's happening with your body. Okay? So, big thing that we want to take out of this: surveys conducted at more than 100 campuses reveal that speed is illicitly used by approximately 6.9 college students. 2.1 have used it in the last month, and this was a survey that was conducted last year. So speed, just a different name for amphetamines. Okay, so definitely this is on the rise in our little bit younger culture. So here are some of the side effects. There's actually about 75 different side effects that can happen from using amphetamines. Here are just some of the most common ones. So this is just the side effects that you can get when something's prescribed to you. All right? So here's when you start using it excessively. Okay? Start taking it so much, you don't worry about eating, you're going to get malnutrition, suicidal thoughts, right? You guys all probably know this. Minnesota is has the highest rate of soldier suicide in the nation, right? Okay. The average age of a soldier that commits suicide in Minnesota is 23 to 24 years old. 80% of those guys have not been deployed. All right. Let's keep an eye on what's going on in their lives. Are they using any of these drugs? Okay. Is that contributing to the suicide rate in Minnesota? So amphetamines versus methamphetamine, Sergeant. This one here is for you. Can you read that one?
Many people mistakenly think that amphetamines and methamphetamines are both the same types of drugs, but they are not. Although both amphetamines and methamphetamines do have many of the same characteristics and qualities. They are both stimulants and they are both dangerous. They are not exactly the same. There are some differences between amphetamines and versus methamphetamines, and though minimal, it is important to know what they are.
Okay. So, when used properly, amphetamine is a powerful drug that can have many uses. Methamphetamine, on the other hand, does not have many uses besides recreational uses anymore. Okay? So some of the side effects for use of methamphetamines. Okay? Methamphetamine, also called meth, crystal, chalk, and ice, among other terms, is an extremely addictive stimulant drug that is chemically similar to an amphetamine and takes the form of a white odorless crystal. Methamphetamine is taken orally, smoked, snorted, or dissolved in water or alcohol, or injected. Okay? This is what you're going to see people start getting a lot of the scabs, thing called meth mouth, things like that. I was going to show you guys a video, but I don't like watching it, so I didn't want to show it to any of you. So, actually, fun fact, this would actually be very high quality meth right here, how clear it is. That's probably something that was made at a very high scale lab in Mexico, right? One of my good buddies is the K-9 unit for Sherburne County. He got to take me to drug school, right? So I got to actually see a bunch of the stuff that we're talking about. The meth that that you would potentially see around here is actually going to be very yellow, very low grade, homemade stuff. All right, that is even more detrimental because of the higher concentrate of chemicals that are in. So the last one is opiates. So what's an opiate? Opiates are a group of drugs that are used for treating pain. They are derived from opium, which comes from the poppy plant. Opiates go by a variety of names, including opiates, opioids, and there is a difference, and we'll see the difference between opiates and opioids in a couple more slides. The term opiates is sometimes used for close relatives of opium, such as codeine, morphine, and heroin. So how many people here has ever had surgery where you've gotten morphine or something like that? All right, so I think unless you had a very negative effect with it, you could probably agree how somebody could get addicted to that very fast. So I remember the first time I got that shot, and it was an immediate shot of I feel awesome, okay? And it was great. For about a week, I got a couple shots, got a couple shots a day. So I did get addicted to it, and I was in a hospital and stuff like that. It wasn't home. So it's understandable how somebody would want to feel. It's a complete feeling of euphoria, and you feel great. So opiate versus opioids. Okay, basically opiates